Hello, my name is Fumilola Taiwo. I am to deliver a presentation which demonstrates my understanding of the roles and the responsibilities of a registered nurse. In this presentation, I will be discussing the recent changes and their impacts on the roles and responsibilities of a registered nurse and the roles of the Nursing and Midwifery Council in relation to nursing practice. I will be giving an analysis of the implication of the Code on Nursing Practice and the role of the registered nurse. I will be giving an explanation of the need for effective communication in a multidisciplinary healthcare setting. And finally, I will be giving an evaluation of the effectiveness of the multidisciplinary approach in a healthcare setting. So that's my slide one, that's my introduction. So slide two, in this slide two, I'll be talking about who a registered nurse is. Who exactly is a registered nurse? According to the Royal College of Nursing in 2002, they define nursing as the use of clinical judgment in the provision of care to enable people to promote, to improve, to maintain, or recover their health, or when death is inevitable, for them to die peacefully. So that is nursing defined, because we cannot define a registered nurse without defining what nursing actually is. So a registered nurse is therefore defined as someone who uses a professional that uses a clinical judgment in the provision of care to enable people to promote their health, to improve it, maintain or recover it, and when death is inevitable, to die peacefully. So registered nurses are a major backbone of the NHS. They spend most of their work days in structured environments by following strict protocols and taking care of patients. So their duties includes accessing patients. They provide care before and after medical operations. They take patient samples. They take temperatures. They take blood pressures. They take all the readings, and they administer medications. They coordinate staff and assist the doctors. So there are four fields in nursing. We've got the adult nursing, the children nursing, learning disability nursing, and mental health nursing. So a registered nurse would either be an adult nurse, a child nurse, a mental health nurse, or a learning disability nurse. They have to be one of these. They could decide to be be learned in all the fields if they want to. They are allowed. I mean, it's all about what you can do. But the least that a registered nurse would be is either an adult nurse, a children nurse, a mental health, learning disability nurse. Well, they must have a degree in one of these fields. So a registered nurse is expected to be caring, compassionate, courageous, committed, have good communication skills, be very confidential with their work, and work under pressure. So that's talking about the 6 C's of nursing, according to the Nursing and Midwifery Council. Going to my slide 3. Slide 3 is talking about the evolution of nursing. So that's talking about how nursing evolved. So nursing, the first nursing training school started in London, and it was founded by Florence Nightingale. That's a picture there, in the year 1860. And that set the standard for modern nurse training. So Florence Nightingale, she had a very great impact during the Crimean War, when all the soldiers were dying as a result of diseases and bad environment. And then she was called upon, and she used all the experience she's got with all the hard work and everything. And then she did a very good job at that point in time to ensure that there was a stop and a reduction in the disease, the rate of the diseases, then by ensuring that the people were washing their hands, keeping their environments clean and all that. And that led to a reduction in the death rate. And as a result of this hard work, the British government paid her a very large sum of money in compensation for her hard work. And that was the money she used to build a hospital in London. And inside that hospital in London was where the first nursing training school started in the year 1860. Afterwards, Ethel Bedford Fenwick, that's a picture down here, she led the movement to claim professional standing for nurses. and this led to the Nurses Registration Act in the year 1919. In the year 1920, the General Nursing Council was set up to maintain a register of general nurses and specialist nurses. So nurse education came to a halt in the mid-1990s and moved from hospitals into the universities. Project 2000 was the first step towards establishing nursing as an all-graduate profession. So this led to the nurses being educated at diploma and degree levels. So nursing training ended and nursing was taken into the universities, and it became a university course, and people back degree courses or diploma certificates in nursing. So that's talking about that was how nursing in the UK evolved. So in my slide 4, I'll be talking about recent changes and impact. Williams in 2017 said, nursing has from inception been a female-dominated profession because women were expected to take up caring roles, but not much has changed as male nurses recruitment level is still very slow. In the year 2016, 11.4% of registered nurses in UK were men, while 10 years ago, there were 11.5% of male nurses. And every effort to promote the number of men in the nursing profession remains stubbornly low, and the proportion of nursing students in the UK who are men hasn't shifted either. Slide 5. And slide 5 is going to be talking about the political changes. So politics has a major impact on nursing roles as the government determines the level of accountability and funding allocation. So the NHS Act of 1946, which promised a comprehensive health service to the UK population, had a great impact on the healthcare professionals as care was shifted to patients and health professionals became accountable for their own decisions. So in the year 1990, the NHS Act was passed into law, and through competition for effectiveness aimed to improve hospital and GP services. So the patient's charter policy moved care from hospital to the community, and nurses became advocates, and this increased accountability. That's according to the Guardian. So in the year 1990, you can see the NHS Act. Their mission was to shift resources to primary care by introducing fundamental change in the management of hospital and family practitioner services. The 1990 Act represents a major shift to community-based care, privatization, accountability, quality assurance, and cost containment that was envisioned over 30 years ago. Slide 6. Okay. So other changes, the economical changes stems from the fact that NHS budget is based on government income. And so as a result, a depleting in government income increases the budget allocated to the NHS and vice versa. So this affects frontliners and the patients receiving care. So when the income of the government increases, the budget allocated to the NHS increases. But when there is a deplete in the income, I mean, there will be a deplete. There will be a decrease in the allocation to the NHS, and this will definitely affect the frontliners and the patients receiving care. So other changes include social changes, which could be an increase in pressure on the NHS due to the aging population, and technological changes due to medical technology and new care innovations has reshaped the NHS and impacted on nurses as they keep retraining to get updated. So as a result of new innovations, new technology, new stuffs coming in, new medications, new equipment and stuff like that, and the NHS has to keep training and training. The nurses have to keep getting updated so that they will be in line and be informed as to what is operating now. So this has reduced errors on the part of the nurses. It has helped them to practice effectively, and it has led to professionalism. My slide 7. The NMC roles in nursing. So the Nursing and Midwifery Council in the UK is the UK regulatory body for nurses and midwives, and their role is to regulate and promote higher education and professional standards across the UK for nurses and midwives. They maintain the register of professionals eligible to practice. They investigate concerns about nurses, midwives, and nursing associates. They speak up for a healthy working environment for nursing. They support them. They share intelligence from the regulatory activities to support workforce planning and decision making. So the NMC creates resources and guidance for nurses, which delivers the correct standards in practice. They give the nurses the chance to address concerns, but they take action when the need arises. So every nurse involved in investigation are duly supported by the NMC. The NMC code implications in nursing. So the NMC code of 2015 states that nurses have a professional duty to put the interest of people first and act to protect them from harm, from abuse, or from neglect. So if a nurse has concerns, they can be dealt with under local safeguarding procedures available within the work environment, or they can be directed to the NMC. So the professional standard for practice and behavior for nurses for midwives and nursing associates includes prioritizing people, practicing effectively, preserving safety, promoting professionalism and trust. So the NMC has got frameworks that helps to guide nurses to deliver effective care, to promote well-being and prevent ill health. They also ensure that there is a price to pay for misconduct, and these measures helps to ensure that health professionals practice with total professionalism so as not to face consequences for bad practice. Slide 9, effective communication in a multidisciplinary approach. So effective communication in a multidisciplinary healthcare setting is very essential as it involves professionals from other disciplines like physiotherapists, psychologists, physicians, nurses, specialists, social workers. They come together and communicate as a team to use their skills and expertise with the support of the patients, the family members, and the community in order to collaborate and achieve a good result. So it encourages effective teamwork, it promotes continuity and clarity within the patient team, it encourages collaboration, it fosters teamwork and prevents errors. Slide 10, effectiveness of the multidisciplinary approach. So the multidisciplinary approach has been proved to be very effective. Through this approach, policies and guidelines are followed by all the team members through good leadership, through teamwork, mutual agreements, commitment, cooperation, mutual respect, openness, and all that. And all this helps to give the best of care to patients. It also facilitates collaboration between professionals. It improves positive care outcomes for people, and it kind of job satisfaction for professionals and practitioners. So a successful multidisciplinary team requires clear purpose, institutional support, role diversity, regular joint meetings, sharing of records, and all that. And with all this in place, accurate diagnosis and treatment decisions are made, care is delivered ethically, and professionals involved are able to understand the medical care that they give. My slide 11 talks about the positives of the multidisciplinary approach. Some of the advantages of the multidisciplinary approach includes the fact that it prevents and manages error, thereby reducing death. It increases life satisfaction, physical well-being, and self-efficiency. It binds the healthcare workers by their code of practice to act with the areas of their roles and responsibilities. So as a result of this, it builds trust, encouragement, and understanding in patients, which leads to better patient-centered health outcomes. It also manages resources and gives members a sense of partnership. And the limitations of the multidisciplinary approach. Some limitation of the approach is that it includes poor communication, which could lead to incomplete decisions, poor documentation, which results in incomplete care because it is not documented. Because if it is not documented, then it didn't happen. Diversity in the educational backgrounds and experiences of team members is also a major limiting factor. So there's also the time pressure involved in providing services, as all members of the team must be updated and carried along with new updates, as it's a collaborative process. Bad team leadership also affects team results and patient outcome. Changes in team membership and lack of mutual respect between members affects patients' outcomes to a very great extent. So in conclusion, nurses' actions can create a cycle of change that has a direct impact on health policy. You can see the assessment level, nursing diagnosis, planning, implementation, evaluation. So that is the nursing cycle. It can bring about a direct impact on the health policy, can turn around everything when everything is done the way it's meant to be done. So in summary, at the end of this presentation, we were able to discuss the recent changes and their impacts on the roles and responsibilities of a registered nurse and the role of the Nursing and Midwifery Council in relation to nursing practice. We were also able to analyze the implication of the Code on Nursing Practice and the role of a registered nurse. We analyzed and explained the need for effective communication in a multidisciplinary healthcare setting and an evaluation of the effectiveness of the multidisciplinary approach. So with this, I've come to the end of my presentation. If there is any question that you want to ask me, you can get across to me and let me know. Thank you very much.